And FCT Health Secretariat grooms adolescent girls for self-reliance. Good evening and welcome to the news at 7 on Nta Channel 5 Abuja. I'm Hakimat Ali. The Minister of the Federal Capital Territory, Nyesom Wike, has declared that the pack and pay policy is illegal. The minister made the declaration while interacting with selected media practitioners in Abuja. Onoze Yakubu has details of the live telecast.
1 year down the lane, the Minister of the Federal Capital Territory, Nyesom Wike, says his stewardship as the 17th FCT Minister has been both interesting and challenging, with the support from President Bola Tinubu and the daunting challenges of changing the narratives on infrastructure development in the FCT. He says presidential approvals on the creation of the FCT Civil Service Commission, creation of new secretariats, and the exemption of the FCTA from the Treasury single accounts, among others, assisted in enhancing development in the nation's capital.
Our ambition is to make FCT a livable city where people can feel comfortable, where we can say yes. We have been traveling around the world. We have seen how cities are planned. We have seen infrastructure in cities. That is our own ambition, to turn FCT to one of the best cities in the world, not only because of infrastructure, but also in terms of environment.
On transportation, the FCT minister discloses that the inaugurated Abuja light rail transport system is already impacting on the lives of the residents, with 4,000 passengers using the eco-friendly transport system on daily basis, with a declaration that the pack and pay policy in the territory is illegal.
Mr. President has given me everything I require to work as far as the FCT is concerned. I don't have any excuse or excuses not to perform, because everything you require as a tool to do your work and to give it. Luckily for me, Mr. President has never one day interfered in anything concerning FCT. Never. And so that's why it's very easy for me and my team to operate.
The minister also hinted that 30 additional schools will be rehabilitated in the FCT, with 75 kilometers of routes to be inaugurated across the area councils of the territory in December. Nyesom Wike, however, reveals that President Bola Tinubu has increased the procurement threshold of the FCT, a development he added will yield positive results. Onoze Yakubu, NTA News.
A paradigm shift in education with a view to promoting literacy in science, technology, engineering, and mathematics. STEM has been the focus of the FCT Health Secretariat and their Center for the Integrated Health Programs. This collaboration is towards empowering adolescent girls and women to becoming self-reliant and encouraging more of them into STEM. Aisha Ubali reports.
Issues of gender-based violence, HIV/AIDS, and poor reproductive health choices have been some of the challenges faced by adolescent girls and women. These are some of the issues speakers at the conference try to address while proffering sustainable solutions. Report has it that HIV/AIDS prevalence among adolescents aged 15 to 19 is estimated to be at 2.9%.
We're going to change things. How can we change things positively so that we as adults who have the responsibility to help young people achieve what they can in life, to be the fulcrum in terms of helping them organize, we really know how to get this done.
FCT Mandate Secretary for Health, Adedolakbo Fashawe, represented by the Acting Director Health Planning and Statistics, Dr. Teresa Ekaite Wachuku, and Deputy Director Community Prevention, NACA, Chigo Gozie Ujam, believe that the synergy among government organizations and non-governmental organizations has helped in providing awareness about HIV/AIDS and reducing the prevalence in the country, as well as boosting the participation of young girls in STEM practice.
We know that there's a lot of issues with young people. If we put barriers in front of them, then we actually cut them off, and that exposes them to more danger.
One of the things that we do is to ensure that there are prevention things in place and that people continue to get tested so that if they need to go on to treatment, they can at least prevent new infections.
The Center for Integrated Health Programs has been at the forefront of empowering young girls across the country, and the STEM Hub, which bettered the launch of Cool Girls Act program, is to provide opportunities for young girls to have self-esteem and be financially literate. Aisha Uba Ali, NTA News.
The Majlis Ansarulah's free medical camp tagged Healthcare for All has kicked off in the Karmajiji community of the Federal Capital Territory. The two-day free medical check-up and treatment taken to the doorsteps of the vulnerable in commemoration of its 48th National Ijetema anniversary was declared open by Professor Saad Ahmed, who represented the Minister of Health. Hawa Gimba takes it up from here.
In the hearts of the Kadmajige community is the home of more than 14,000 vulnerable people from diverse tribes and religions. A two-day free medical camp is at their doorstep, springing hope and healing. Promoters of these free Medicare, Majlis Ansarullah, in partnership with the Federal Ministry of Health, launched this initiative to boost the health and well-being of Nigerian communities. The Minister of Health, represented by the Chief Medical Director, Federal Medical Center, Abuja, Professor Saad Ahmed, declared the camp open. The minister emphasizes that the present administration regards it as paramount, the health of every Nigerian.
You can see this is a free health camp where people can come, they get screened. Those that seem to have some issues will be taken care of. And then subsequently they can go to any of our public hospitals to continue with their care.
The Nabil Amil Special Duties of Ahmadiyya, Sirajuddin Abdul Salam Kofo Alada, highlights the group's mission to give back to communities in the FCT and beyond by providing the best of health care and wellness.
The principles of our existence is about humanity, and the Jamaat gives a lot of priority to this, to the extent that the Jamaat has a body we call Humanity First. And that body has actually is involved in providing social amenities.
And we feel highly honored because it's one thing to make provision for things. It's another thing that you see people that will benefit from that provision.
That this is free medical checkup, and I think that they should cooperate and organize well so that as we say, that health is wealth.
They should keep coming to help us because there are many poor people that cannot afford medication.
It's a welcome development.
As the community comes together to assess vital services, the impact is clear. Improved health, renewed hope, and a strong sense of community. Hawa Gimba, NTA News.
According to research by the World Health Organization, 1,780 cases of lung cancer is diagnosed per annum, which makes it the leading cause of cancer deaths worldwide. Therefore, the need for more awareness on the disease, as well as aggressive research and health aid in curbing the menace, is imperative. Cecilia Julius gives us an insight on this.
Lung cancer is said to be one of the leading causes of cancer deaths worldwide, which experts say ranges from a varied number of causes such as smoking, exposure to toxic chemicals and smokers, as well as family history of the disease. While speaking with a pulmonologist on the causes and symptoms of lung cancer and its varied challenges, offers his expertise on the remedy.
Chief amongst these things is smoking, cigarette smoking, tobacco use of any kind, both cigarette, cigar, and of course you are aware of the current rave in town, shisha, vaping, and all the other things. So they are all associated with lung cancer. And I must quickly add that in relation to smoking, if don't say, oh, I'm not smoking, I'm not entitled. If you are not smoking but your friends are smoking, your husband or your spouses are smoking, you are a secondhand smoker, you're also entitled to about 25% of the risk. Also exposure to chemicals, PVCs can cause lung cancer. Even the asbestos, that we use, it's been regarded as a cancer, but that yes, it's not primarily lung, but affects the clot covering the lungs.
However, having 97% mortality rate statistics by World Health Organization, lung cancer can be averted if the following preventive measures are adhered to.
The early detection of this disease, we might be able to apply this so that you don't allow the disease to progress. This cough that you are treating that is not going, it could be what? Lung cancer. So get screened for lung cancer because there is now treatment available.
Above all, remember that keeping your health on the safe track begins with you. So keep healthy and stay healthy. In Abuja, Cecilia Julius, NTA News.
In today's digitally saturated world, it is easy to get caught up in the endless stream of notifications, likes, and shares. But at what cost? By adopting a digital lifestyle adjustment, experts believe can prevent distractions and enhance productivity in the real world. In this special report, Taibat Anifowoshe takes a look at the concept of digital minimalism.
Digital minimalism is often associated with an intentional exposure to the use of digital tools, which experts say might be the solution to the numerous psychological problems associated with overindulgence in technology.
Digital minimalism can significantly mitigate the negative effects of social media on mental health. Here's how. It can reduce anxiety and stress. You know very well that constant notifications and the pressure to stay connected can lead to anxiety. Every time that, especially when you are addicted to your phone or addicted to a particular app, for example, TikTok. There's a lot of funny things on TikTok that a lot of people that get people hooked up when they're addicted to it. So that could put pressure on you. To be honest with you, it could put pressure on you. See people wearing certain clothes that you can't afford. You see your friends are going far in life and you want to aspire to be like them. That could push you to do things you're not supposed to do.
The term digital minimalism was first coined in a book titled Digital Minimalism, Choosing a Focused Life in a Noisy World by Cal Newport, a professor of computer science at the Georgetown University in the United States. Today, many individuals and corporate bodies already practice this concept to boost their productivity.
Digital distraction can significantly impact productivity and focus because sometimes when you are not mindful on what you use your phone for, your phone is full of so many things, especially I check some people's phone and I see they have so many apps. What are you using this app for? They will tell you, okay, when I'm free, when I'm bored, I can use this app. Sometimes you get addicted to it.
For some industry players, digital minimalism might be able to address the issues of security and privacy.
Yes, I think practicing digital minimalism can address the issues of security and privacy. And that's on a personal level. Because you really don't have to bother about protecting what's not out there in the first place. So basically, the risk of your data being used or hijacked by hackers is reduced drastically if you really don't have much out there.
Experts agree that a simple, carefully curated digital life is not a rejection of technology. Instead, it is recognizing and embracing the immense value that these new tools can offer. However, this is expressly on the condition that one is willing to do the hard work of figuring out how best to utilize them for things that truly matter. In Abuja, Toyiba Anifowoshe, NTA News.
Now let's join the sports desk for Sports Brief.
Nigeria's athletes have begun their preparation for the 2024 Paralympic Games in Paris with a 10-day training camp in Saarbrücken, Germany. The team, accompanied by officials, will then head to Paris for the Games. The Director of Press and PR for the Ministry of Sports, Mrs. Kehinde Ajayi, stated that the General Team Manager, Mrs. Tekla Opara, has arrived at the training camp to assess the athletes' progress and boost their morale. Ms. Opara emphasized the importance of the athletes' performance, saying they carry the hopes and aspirations of all Nigerians. She expressed satisfaction with the training facilities and encouraged the athletes to demonstrate patriotism and resilience to secure a podium finish. Meanwhile, Sports Writers Association of Nigeria, SWAN, has criticized Team Nigeria's performance at the 2024 Olympics and called on the sports minister to take responsibility. SWAN also commended President Bola Ahmed Tinubu for allocating 12 billion naira for the Olympics and Paralympics. In other news, Edo Queen Suliat Abidin has been voted man of the match in the CAF Women's Champions League semi-finals against Inter de Abidjan, and is expected to continue her strong performance in the final qualifier against Ainonvi. With Sports Brief, Wayne Lugo, NTA News.
Thanks for watching NTA Channel 5 Abuja at 7. Up next is the news translations.
azanu ajile ba yi ba ci ba wai yuze ko ngwa wai wona na wo abadana tuko na tuko ishan daje suma woniye wa guba ngai minister bakin sun da ya yarshin wuke wabu gage moto no oza yashi nge we jezebe nsahe wala wa gba aba itai nge koto dinalo no nzokon ko into wule chowo ajin ko lenu dinanu bakin sun dan oneze yakubu wona le shiba we be na bedai wa gege minister we dade no abeda kui osa no abegin ayanwo abeyan ya chei owo ye shogun debujiyan shobe ya beji minister na ya shi nyaji la nyaji shado ozawo shi yanyan wo shi wa enya pota de la aku yepe shi awe no awe chei shoko mwalo welo no abei no no apabui zoku sapa ayam sapa bedo no abe ajokui aisha uba abi wale sheba webe na bedai wa ngege akinzinda kwatne jimba nsbeye lafiya ya kojilo oishi abe awe na bage kwabma abi aniji mbajin be kpnkpbe bedo no ayin ko kasai na bage zo za he wa bwa obejin to ozejin wa jin pe ma nza kani oza odiya yun bedogun lafiya ya peje selanya no ayiko ge majelis alsa rulayin bakulo jigba no ayiko ge garama jiji nkoni filo nanu okinsin nan no bada tukoi nge lafiya ko jin zahai inyanu hawa gimba ona leshe ba we be na bedai wa gan ba leshi jigba enu ba mu azanai lafiya ba ce ba ga azashigbe nu agada Professor Said Ahmed wonu agu yeje ya nu aya ajunko ampe egun aba ni minister lafiya ya aputa ajinde nu ba pa eye shi ni che mo nyimabo omaje abo babo onilanu size.
Jama'a assalamu alaikum barkanmu da warhaka kamar yadda aka saba a takaice ga fassarar wasu daga cikin labaran mu yau mai karantawa Yusuf Yakub. A shirin tattaunawa da manema labarai da ministan babban birnin tarayyar ƙasa Abuja Musa muke yayi wakilin mu Shaibu wani zai Yakubu ya shaida mana cewa ministan ya bayyana cewa dokar biya wa motar da aka ajiye kuɗi ta saɓawa shari'a, inda ya buƙaci a sake duba lamarin domin samarwa da al'ummar ƙasa mafita da kuma ci gaba. Samar da ilimi ga kowa domin bunƙasa ilimi a fannonin kimiyya, fasaha, lissafi da sauransu shine babban abin da sakatariyar lafiya da shirye-shiryen lafiya za su mai da hankali don kyautata rayuwar al'umma. Wakilar mu Aisha Uba Ali ta shaida mana cewa haɗin gwiwar da hukumomin za su yi shi ne domin bunƙasa rayuwar 'yan mata da manyan mata su zamanto masu dogaro da kansu tare da ƙarawa sauran mata ƙwarin gwiwar shiga cikin tsarin. Ƙungiyar Majalis Ansarullah ta fara hidimar ba da tallafin kiwon lafiya ga al'umma mazauna ƙauyen Karmajiji. Shirin da ta yi wa take da ba da gudunmawar kiwon lafiya kyauta. Wakilai Hauwa Gimba ta rawaito mana cewa ƙungiyar ta fara hidimar dubawa da ba da magani na kwana biyu ga al'umma masu ƙaramin ƙarfi har matsugunansu a matsayin harkokinta na bikin tunawa da cikarta shekara 48 wanda Farfesa Sa'ad Ahmad ya gabatar ga ministan lafiya. To abin da ya sauka kenan a labarin namu ne, sai kuma gobe idan Allah ya kama mu kwana lafiya.
Ekele m gị Igbo wem, oge erukwala ọzọ maka akụkọ ụwa nke taa. Ọkọ akụkọ ka bụkwa mụ Rachel Ifi Ono. Gere akụkọ ụwa n'uju ya. Minista n'isi ala anyị Nyesom Wike ekwuola na ịna ndị ọkwọ ụgbọala ego ala maka ebe ha kwụsịrị ụgbọala ha bụ ihe na-ezighị ezi na usoro iwu. Onye ọrụ anyị Onoze Yakubu wetara akụkọ na ya bụ minista kwupụtara nke a mgbe ọ na-eme emume ịgba afọ ya dịka minista n'isi ala anyị. Ọ gbakwunyekwara na o kpughere nke a nye ndị nta akụkọ ụfọdụ ọ họpụtara mgbe ya na ha na-eme mkparịta ụka n'isi ala anyị. Ịhụ na akwalitere sayensị, teknọlọji, injiniarịn nakwa mgbakọ na mwepụ abụrụla ihe a gbadoro ụkwụ mgbe ụlọọrụ na-ahụ maka ahụike n'isi ala anyị nyere ụmụaka na-eto eto na ndị nne nkwado. Onye ọrụ Aisha Ubali wetara akụkọ na ụlọọrụ na-ahụ maka ahụike na ụlọọrụ akpọrọ Integrated Health Programs jikọrọ aka ọnụ ma kwado ụmụaka ndị nwanyị na-eto eto nakwa ndị nne n'ihe banyere teknọlọji. Ndị otu okpukperechi Islam akpọrọ Majlis Ansarullah amalitela nlekọta ahụike n'ime obodo Karmajigi dị n'isi ala anyị Awagimba wetara akụkọ na ya bụ nlekọta ahụike nke isiokwu ya bụ nlekọta ahụike maka mmadụ niile bụ nke ha ga-eji abalị 2 mee. O kwekwara nghọta na ndị otu a jiri ilekọta ndị na-enweghị ka ọ hara ha na ndị nwere ihe nkwarụ were merube emume ịgba afọ 48 nke ya bụ otu. Igbo ebe a ka ị pịachiri nke taa. Sonyere anyị n'ihe oge a echi niile. Ndewo.
Ẹ̀kálẹ́ o, ìròyìn ló ń dé sí etí gbọ́ yín láti iléeṣẹ́ amóhùnmáwòrán ìkànnì karùn-ún l'Àbújá. Ọláyínká Adéníjì ni oníròyìn yín. Mínísítà fún olú ìlú Nàìjíríà Àbújá Nyesom Wike ti fìdí rẹ̀ múlẹ̀ wípé igbó àtú lásán ni ètò ìgbọ́kọ̀kalẹ̀ sanwó tó ń lọ lọ́wọ́ nílùú Àbújá. Nígbà tó ń bá àwọn àṣàyàn akọ̀ròyìn sọ̀rọ̀ nílùú Àbújá ni mínísítà náà pàgede ọ̀rọ̀ yìí. Aṣojúkọ̀ròyìn wa Ọ̀nàzè Yakubu jábọ̀ wípé òtún bá ń tẹ́ni kí àwọn ará Àbújá ó sanwó fẹ́nikẹ́ni látàrí wípé wọ́n gbé ọkọ̀ wọn síbì kan lọ kábọ̀. Irúfẹ́ ẹni tó bá gbowó lọ́wọ́ ọlọ́kọ̀ kan tàbí èkejì jẹ́ ẹ̀họ̀nà tí irúfẹ́ ènìyàn bẹ́ẹ̀ gbọ́dọ̀ fojú balẹ̀ ẹjọ́. Àyípadà onídàgbàsókè tó bá ẹ̀ka ètò ẹ̀kọ́ ní èyí tó mú ẹ̀kọ́ sáyẹ́ǹsì, ìmọ̀ ẹ̀rọ àti ètò ẹ̀kọ́ ìṣègùn ṣe wà tẹ́lẹ̀ rí látàrí wípé ẹ̀ka tó ń ṣètò ẹ̀kọ́ nílùú Àbújá ti mú dájú wípé ìfọwọ́sowọ́pọ̀ pẹ̀lú iléeṣẹ́ aládàáni lórí ọ̀rọ̀ yìí yóò mú kí àwọn ọ̀dọ́langba obìnrin ó ní ìmọ̀ tó yanrantí ní èyí tí ètò ẹ̀kọ́ wọn gẹ́gẹ́ bí Aisha Ubali aṣojúkọ̀ròyìn wa ṣe jábọ̀. Àjọ Malis Ansarullah ti gbàgede ètò ìlera ọ̀fẹ́ ní èyí tí wọ́n pàgọ́ rẹ̀ sí ìletò Karamadidi nílùú Àbújá fún àwọn ènìyàn. Ọ̀mọ̀wé Saad Ahmed tó ṣojú mínísítà fún ètò ìlera níbi ìbẹ̀rẹ̀ ètò ọlọ́jọ́ méjì ọ̀hún gẹ́gẹ́ bí aṣojúkọ̀ròyìn wa Awagimba ṣe jábọ̀ ní ìsàmì ayẹyẹ 51 ọdún ìjẹ́tẹ̀mà ni wọ́n ṣe gùnlé ètò ìlera ọ̀fẹ́ yìí. Tó èèyàn mú kò ní jù báyìí lọ ọ̀kọ̀ọ̀kan láòjì ò kásùn láyọ̀.